floss first, you brush, and then you rinse with like any antibacterial rinse. Hi, my name is Nadege. I'm a dental hygienist for about 31 years, and I'm obsessed with what I do. People have a tendency of forgetting to do that part, which is the flossing part, because you feel like you're already cleaning, so everything is good. From my perspective, the reason why I advise all my patients to first floss is you want to disrupt the tartar in between, and you brush. That way, when you rinse it out, you already remove it out of between your teeth. You don't want to keep putting dirty floss on top of the other teeth, because then it's like you're moving dirt and put it on another tooth, you put dirt on dirt, right? The proper way to do it, you would take a decent amount of the floss material. You wrap almost all of it in your right middle finger, and you leave a little bit on your left middle finger. You don't want to snap the floss in, because then you inadvertently cut your gum and patient would stop flossing because they're bleeding. It's not necessarily what you're doing is wrong, it's the way you're inserting the floss that's wrong. So you want to walk the floss in this way. If you leave it straight, you're cutting the gum, and you're really not really removing the plaque, because the plaque really adheres around the tooth line, right? So you circle it around, you make a C with it around the tooth. So you want to do a couple of scooping motion, right? Once you do that, you move on to the next side, and then you do the same thing. And then you want to take the floss out. If the floss is not coming out because your teeth are too tight, you want to remove that hand, you want to slide it through. That way you're not like ripping the floss off. Don't forget, even though you don't have a tooth after the last one, but that area where the gum is has a lot of plaque that sits there, especially because you don't have another tooth, the gum around it. Always remember, it's always time you're doing something instead of nothing. So preferably if you're going to floss once a day, it's better to do it at night, because you've eaten all day and everything stays in between your teeth. You don't want to go to bed with the plaque and the food staying in between your teeth. Flossing is a way of brushing the outer layers of your teeth. Your toothbrush does not fit in between your teeth. So if you're going to brush on the outer layers, you also have to brush in between, and that's when flossing comes into hand. I recommend, of course, to floss first to disrupt the plaque in between your teeth, and then you move on after you floss. You could rinse after that, because sometimes you have food debris. You could rinse real quick, and after that, then you move on to the brushing. You want to brush not with your teeth together. A lot of people do this. When you do this, if you notice, you're only brushing the top ones, because naturally your top teeth overlap the bottom ones. And so when you do that, you're not brushing the plaque where it sits at the gum line on the bottom. The brush has to be at a 45-degree angle, where the last bristle is slightly at the gum line. Not 100 degree, then you're only brushing your gum. You want it 45-degree angle, and you want to do it in a circular motion, not back and forth, not up and down, because they're fine. Back and forth, you destroy the gum. Up and down, you also destroy the gum. So it is recommended that you do it in a circular motion, and you're not really moving your hand, you're moving the brush, okay, like this. You go around. And then when you reach this area, it is recommended that you hold the brush in a vertical position, not horizontal, because the curve of the mouth, when you do horizontal, you're missing the main areas there. So if you hold your brush, you use the tip of the brush or the heel of the brush to brush the bottom teeth, the front ones, the top teeth on the inside, this way. And then you go to the top, 45-degree angle, you brush, and then like that. A good brush should last about 2 to 3 minutes. You don't want to rush, especially at night. You know, if you're not working, you have some free time, then you spend some extra time on your teeth. Rinsing, I recommend alcohol-free rinse as long as it's antibacterial, only because the alcohol have a tendency of drying the gum, which would probably cause more bleeding. So I recommend alcohol-free. I've had patients who are like 75 years old and they never was told to brush their tongue, let alone use a tongue scraper. 90% of the time, bad breath comes from not cleaning your tongue. Because in the back of your tongue, you have all this little hairy fungiform and stuff that hold on to milk, especially. They hold on to anything you eat, and if you're not taking that out, no matter how much you brush your teeth, you're going to have bad breath. You should change your toothbrush every 3 months. Unless you've had a cold and it's before the 3 months, absolutely throw it away, because then you're reintroducing bacteria in your mouth that's going to cause you to be sick again. Yeah, you should, every 3 months. So I've given you all the tools. This is the proper way to clean your teeth. So go on now, go brush your teeth.